Welcome back, health professionals. It is great to see you again this morning. Looking forward to you joining this incredible conversation that I am having with the one, the only, the almost famous Cindy Doyle. So the purpose of this conversation this morning is to start to progress the conversation that enables us as health professionals to move beyond wondering about burnout and when burnout might happen to actually taking control of our time, our money, our energy, and enabling us to focus ourselves on the things that are most important to future-proof ourselves. So I'm going to bring Cindy on quickly because she's here. She's ready to go, which is awesome because she's talking to me all the way from Texas. Don't we just love the way internet, all the world, to be able to come together, to share information, to share ideas, and to progress this conversation. Hello, Cindy.
Hey, Miss Jo. You're over there cold and I'm over here hot. So there you go.
Yeah, I knew we were going to have a weather report today. So I'm just wondering if is it Texas hot today? Is it like the skin wants to melt off hot? No, okay. All right. Yep. No,
it's like
I have
93.
Oh, okay. So for the rest of us, that's the mid-30s. That's still hot. That's still a little warm. So Cindy, let's jump straight into this so that everybody gets a chance to know who you are. So what's your background? How long have you been licensed and what are you licensed to do?
Oh my goodness. Okay, so I actually I'm a licensed professional counselor in the state of Texas. That's where my license is. I have been licensed since 1998. So a long time. I worked in nonprofit for 15 years, and then but part of that was undergraduate years too, and left to go into private practice in 2008, partially because there was a hard shove, which if you want to talk about, we could talk about at some point in time. Sometimes we don't listen to those gentle nudges, and so the universe has a way of like throwing it to you. So yep, that's pretty much it. And so I went into private practice in 2008 and then started a group practice, actually started my own practice in 2010, which is now a group practice with several other therapists. There's 7 or 8 of us total. I always forget, maybe 9 because I have somebody who's really part-time. So primarily I work with individuals and couples. I specialize in working with first responders in regard to their relationships and also their trauma. But I also work with spouses as far as that. I also work with a lot of other health professionals. And so some of that is including other clinicians that I support. Some of them are other, I would say, health professionals that I also consider kind of first responders. So people that are working in the hospitals, emergency rooms, things like that. So that's kind of what I do.
Oh, that in a nutshell.
In a nutshell.
Apart from that, you have a very popular and incredibly informative podcast. I, for one, that has been revolutionary for me in how I even talk to the law enforcement personnel and first responders in my world. That has been such a gift for me. You've written a book, which I had the privilege of helping you work on. And I know that book has just been an amazing resource. Yeah. No, it's like, where are my things? Didn't know Joe was going to talk about that today. So I am so grateful that you said yes when I was putting this symposium together. And I guess there's one thing I want to speak into straight away, which is all of us. I've chosen, everybody who's on this symposium is here for a reason. And it's because we've got some wisdom and some years. But every single one of us has gone and graduated in 1996 as if that's a bad thing. And I remember speaking, I think it was the Therapy Reimagined conference back in 2019 when I made everybody over the age of 60 who was still in practice stand up in the room. And I made everybody in that conference honor those people because they're the ones we need to be listening to. You know, if we don't listen to what they've got to say, we're not going to work out what it is that we need to do different. Yeah.
Mm-hmm. Yes.
So, yay for graduating in the 90s.
Woo woo.
Very cool. The other thing I love about the work that you do is working with first responders and law enforcement. I know that health professionals, and particularly mental health professionals, can have a lot of negativity towards law enforcement personnel. And we get it. Like, systemically, the way our law enforcement can sometimes police or manage themselves can be really detrimental to the health and safety of everyday citizens.
Yes.
But if we don't have people like you getting in there and showing them that there's a different way to be, explaining to them the impact of their words, their attitudes, then we're never going to see a change. So we kind of need to work together on that. And that's why I get excited when I see the posts that you're putting up and the types of places. I mean, you get called into, I don't understand all the levels of policing, but you get called into some pretty big policing matters now, right?
Yeah. I've been called into several statewide organizations and connected with some national professional organizations for sure.
Yeah, so that excites me, because I know that we've got people working with the community who are feeling the brunt of the somewhat ineffective policing or law enforcement. But then we've got people on the inside going, hey, I'm here. I want to change it from the inside out. So high five to you. That's
Thanks.
not a slap in the forehead. That's a high five.
I'll take it back.
Oh, very cool. So I have asked you to come and be a part of the Future of the Health Professional Symposium. So I'm curious to know, what is the one thing that you think we as health professionals need to know or be able to do to be able to keep doing this work?
The one thing that, if I have to narrow it down to one thing, because there's multiple, but what I think is really important is embracing that idea that we don't have to be perfect, that we are human no matter what. There's a lot of pressure on us to do the things. As a supervisor who works with new clinicians and helps them, mentors them along the way, I am shocked at what they are coming out with. And like, I've got all these extra certifications and I'm thinking to myself, I just want to get you ready to like hear what you need to hear and have the basic skills. It's not our job to fix everybody. We're just supposed to be with them. Many times what I hear is this idea of like, I have to be perfect. I have to have all the knowledge. I have to know all the things. I have to solve all the problems. And that's a lot of pressure. Anecdotally, what I'm hearing is that the average new mental health professional, at least in the US, the average individual stays 5 years. And we can't have that kind of, yes, that's why I thought it was ironic that you were mentioning the 1998 thing. Yes. So that's the anecdotal evidence. There's a lot of evidence out there of very quick burnout, the pressure, because I'm going to speak from the mental health aspect, but there's all these pressures right now in our community as far as health professionals showing up, doing what they need to do. And then the added pressures of COVID and adjusting and pivoting and all these aspects that we have to do. And we're expected to, I think we expect ourselves to be perfect at it and know all the things. And so when something comes out or there's a new legislation or a new pivot that we have to make, we worry about being wrong as opposed to just like, I'm going to do the best that I can with this. And if I need to adjust, I'm going to adjust. I can go back and say, wow, I just did the best I could. Let me adjust and do that differently. And I think a big reason for that is what's instilled in us is that if we don't do it right, then we're going to be in trouble, right? So I have to be perfect. There's going to be a complaint against me. The government is going to come out and get me. Like there's this fear that comes around with it. And so because of that, we wind up being perfect. We are afraid of failing. And I think that kind of bleeds into, and I'm speaking for myself because, you know, I've been there and done that, and I continue to be scared. One of the things that I texted Joe right before this, and I'm like, I'm here and I might pee my pants because I'm a little nervous because like, this is just like, you just do it scared, right? Part of it is just doing the thing. I also think it prevents us from showing up out externally from the therapy room, at least for us, or externally in other ways, as far as educating, as far as getting the word out. We worry about judgment and how we're going to be seen and not, once again, not being perfect or failing at things. And I think all of us have a lot to say out in other realms beyond our little practice offices, whatever they
mm,
might be.
mm.
And we have to be brave enough to say the things that we want to say. And it doesn't mean that it's not going to be uncomfortable. And we still have to do it. Like, I think it's important for us to do it. Advocacy was something that was really instilled in me, and I was really uncomfortable with it until it's like, if it's not going to be like, if it's going to be, it's up to me. Like, I have to say some things.
Yes. Yes.
And so
Yes.
tying that kind of back to the law enforcement part, it's like, well, if I can keep these people healthy, if I can get them healthier, then they can be healthier to serve communities. Or if I can make it okay for other health professionals to fall on their face and know how to get back up, and that it's just a part of life to fall on your face. And just because you're in your role doesn't mean you have to be perfect. Like, I'd love to do that. So that's what I'm excited about talking about with your crowd.
Oh, this is going to be great. So we would tell clients, regardless of whether you're a physical therapist or an occupational therapist, we would give our clients permission to fail, or, you know, take little steps, or take 2 steps forward and 1 step, especially when they're doing something new for the first time. We would do that with a mental health client as well. We'll go, hey, we're going to learn how to have a conversation with that person that has been mean and nasty to you. Let's just do one thing at a time. But you're right. For us, it's like, I have to be perfect at all the things. I have to know how to work with all the diagnostic criteria. In fact, I need to recite the DSM-4 revised version, and I need to know it verbatim. Or I need to know how this drug works, or I need to know how this person's going to react. And it's impossible. Like, the thing that I get excited about when I have this conversation is that every health professional on the planet had to go to health professional school. Right?
Yes.
So we know how to learn.
We're really good at that.
Yeah. In fact, many of us collect learning, and we have a great big long filing system.
Hi, I'm Cindy. I'm a collector. Yes, been there, done that. I'm a recovering collector for sure. Like, if I know more of the things, then I will be impenetrable, right? Like, people can't get through my armor. It's a way of protecting ourselves.
Very good, Cindy. It is very much a way of protecting ourselves. But like we've identified, you've lived through some stuff. So you also said that you started your private practice and group practice during the global financial crisis. Would that be correct?
Yes.
Yeah.
And I did. And I'm still here. Go figure.
So we had to learn how to pivot, be agile, change, you know, work out how to do this thing in an environment where there was incredible amount of social instability and an incredible amount of fear. And look where we are now. So the social instability might look a little different. The fear in the community might be about different things, but you know what? We've learned through some of that stuff. Like, we're able to apply some of what we learned there, which isn't all just about money either, but it's about how we look after ourselves so that we can look after the people coming to see us.
There's a couple of things that you've mentioned, is that idea of that it's okay to fail, but also that idea of like taking small steps and trying it, and the compassion, right? When we have other people in our offices and we're encouraging them, we encourage them to have compassion for themselves, to understand that they're not going to get it perfect the first time. And the second part that I would say, as far as like doing things like we're not sure what it's going to look like, it seems like every time we're like, sure, we're saying we're not sure what this is going to look like COVID, we weren't sure what it was going to look like. And yet I was busier during COVID than ever. I was burning the candle at both ends because I had so many clients coming back, and I had to reevaluate, what am I going to do here? In 2008, I worked with companies that were laying off people and helping them to find their footing and to help them recover emotionally and mentally. We are in a field that people need health professionals, and we've just got to pay attention to what's going on, because that need is not going to be going away. It just may look different, and we have to be okay with not knowing and just kind of taking one step at a time, right? There's that whole idea of like, I may not know what's coming. I have faith in myself that I'm going to be okay, and I'm going to be able to figure it out and make those changes, and that's okay. instead
Yeah.
of what ifing it to death.
Yes, and then being afraid to take clients or work with clients because you're afraid of the what if, the what
Yeah.
if, the what
Yes.
if. Yeah.
Yes.
Mm.
Yes.
So when you're presenting at the symposium, which is happening, starts next week, so the last 2 weeks in September, and we've got the go live on the registration today. Woohoo! That's very
It's
exciting for me.
so amazing. This collective you have gathered. Oh my gosh. I'm honored to be a part of this group. So
Yeah,
super
it's pretty
cool.
cool. Yeah, every time I must admit, the first time I saw the draft, I did go a bit weepy, going, "Ooh, look what we've done." Not so. Coming to your session,
Mm-hmm.
what will people learn or walk away being able to do?
So what people will learn and walk away being able to do is I have an acronym that I'm going to teach to help people understand that those ups and downs are just a part of life. I like to use uh, the, oh my gosh, my mind just went blank, and that's how it works. And this is okay. I like to use the hero's journey. And
Yep.
I use that as an analogy that many times we are so attracted by other people's journey and their struggles and how they overcome things. And we forget that we are actually in our own hero's journey. And so I use that analogy to show how moving through life and the ups and downs, it's not really an ups and down, it's more like a circle if we're going to do the hero's journey, and how to move through it. And I have a step for my acronym of human. And so you will learn what my acronym means, that it's all about being human, and be able to use that acronym to move through those points and times in your life when you feel like you're isolated or alone or you're scared. So that's
Yeah.
really what it's all about.
Yeah, and it's such an incredible framework because it builds on
Thanks.
other speakers' concepts of resilience and being resilient. So, and I've pulled everybody together quite purposefully. It's not just a random collective of people I like. It's like we've all got a message that builds on each other, so that as you
Mm-hmm.
move through the symposium, you're actually building on session 1, session 2, session 3, right through to session 11. 11 sessions. So that is going to be really cool, Cindy. So can I ask you a couple of fun questions?
Oh, absolutely.
What was your very first paying job?
My very first paying job ever was
Ever?
as a a babysitter. I
Yep,
babysat.
there you
Yeah, I had to go back really quickly. I was like, wait, no.
go.
I babysat. This is kind of entertaining. Just really quickly, I babysat, and I had a family that I babysat regularly, and this 4-year-old brought down his daddy's Playboy magazine, and I was like, I don't think we should have that. And the 8-year-old was like, oh, my dad lets us look at these all the time. No, so
Okay.
yes, babysitting. I definitely
Fine.
babysat.
Fine. Wow. I wanted my next question from that is how's that prepared you for being a therapist? But I actually don't want to know the answer to that question.
I think, part of that, I think, is like rolling with it. I think that that idea of they're those two little boys, woo, let me tell you. But I think rolling with it, that like being presented and me not going, oh my gosh, and freaking out
Yeah.
is probably something that
Yeah.
prepared me. I mean, you just threw that at me, but I looked at that and I went, that might be true, but that's not something that I'm comfortable with. So we're going to put that away. Cindy's boundary setting before she even knew it was her job.
Oh, that's great, Cindy. Thank you. Nicely done, because you were
Thanks.
completely unprepared for that question.
I was.
So let me bring the next question completely unprepared for. Who is your favorite fictional character? Think TV or movie or a book.
You know what? I don't have a whole lot of fictional characters I connect with. Gosh, I'm trying to remember. There's a series of detective books, and I cannot remember. Oh, I cannot remember the character's name, but she's a detective, and it's futuristic because I like sci-fi. And I wish I could remember her name, Eve something, and I cannot remember her last name right now. But I love her as a character because she's so strong and self-assured on the job. And
Oh,
yet,
cool.
because she's this police detective and she's a badass. I just swore, sorry. But, and so I love that. And then she meets this man named Rourke. And Rourke is this, he's all the things, right? And he disarms her, but part of this is that she has this background and this trauma history that she's moving through, and she overcompensated by being this police detective. I can't relate to any of this in my world. And I love it because Rourke is able to disarm her and make her vulnerable and make her melt. And he is able to go, no, you have a need, and I will take care of that need. Get out of the way. And so I love her just because I connect with her, because I think I was an overfunctioner and I still move into that overfunctioning category. And even recently, 10 days ago, I had my friends going, no, you need me and I'm going to do this for you. So I think I relate to that a lot because I see the hustle that I have had in my life to overcompensate. And then maybe that idea of people disarming. Now I happen to have somebody in the other room that did that to me. So I don't know, maybe there's something like that, but I really like her character. So
I really want to find out. So if anybody watching, Diane, Jim, Linda, anyone watching, if you know about Eve and Rock, you want to let us know who these characters are and the titles of the books, because Joe's got some reading to do. So Cindy, a little bit more of a serious question. When you first graduated and were a newly minted mental health professional, what used to intimidate you?
Oh, the exact thing that I'm talking about now. I thought I had to be perfect. There were things that I stopped myself from doing. I wouldn't do because I thought I didn't know enough to do them. And so instead of stepping into something that was uncomfortable and saying, I'm going to do my best and show up and learn, instead of saying yes to things, I said no to things all the time. So I was nervous to try anything new. I was nervous to move outside of my comfort zone. And I really didn't, I wanted to stay safe. And that is something that I've had to move through myself. And so that is why I'm so passionate about it now. I'm like, do all the scary things. So I was just scared to do much of anything. I was like, unless it's something I've already known and dealt with in my life, then I probably can't help you or fix it. Because I was very much into I thought I had to have all the answers. I didn't really understand that my role was kind of to be there and to walk with clients. So that, I know it's a broad answer, but that's my answer.
No, and I think there's been quite a lot of activity going on. I think people relate to it because we do come out of any health professional education experience, and it's been drummed into us. If you make the wrong decision, people can be very harmed. Nobody went into health professional school to hurt people. We all went to help people. So from, your very first lecture, it's like, we're going to teach you how to be awesome health professionals so people get the care that they need, because you can't hurt people, And so it's always in the back of our mind. And then if you hurt somebody,
they just toss you out there all by yourself. And I'm like, I mean, it's always kind of I can label it as imposter syndrome. I think that gets used a lot. I think it's just, that fear too, the fear of failing, the fear of being imperfect, the fear of screwing somebody up. Right. Yeah. And that's part of the reason why, unfortunately, we don't talk to each other and say, hey, I'm really scared I'm doing this wrong. Can I get some help? And I think we get some of that, but not as much as other professions where it's like, hey, I need some mentoring. I need some coaching on this business situation. So
yeah, and we don't have water cooler talk anymore, because water cooler talk, it shows your vulnerabilities, and then we all go into that place of they're going to think I'm incompetent, and incompetence means that I'll never work again, and we very quickly go into this shame spiral around it. Anywho, Cindy, what intimidates you about this work now?
What intimidates me, I think I don't really know. I just know that I'm always, I kind of just give myself a lot of grace. And so I know I don't have all the answers, and for me, it's like, okay that I don't have all the answers. So probably what would intimidate me is getting attacked in some
Mm,
way. I kind of
mm,
move through that. I get kind of some jabs over social media, and that's not
mm-hmm,
always fun. I think what intimidates me is maybe embracing the fact that I have something to say and that I can impact more people. That's probably, honestly, like that's my biggest intimidation. It's easy for me to stay in my law enforcement audiences and like
mm,
as I go up the chain, those kinds of things. In the therapy room, I think what's intimidated me in the past is it's like, oh, well, if you don't have this skill, then you're not a real therapist. So some
mm,
of
mm,
that has intimidated me in the past. I used to get intimidated. I have mental health clients that come to me, like as in
mm.
counselors, right? And they'll mention things like some fancy theory, and I'm like, okay, I have no idea what you're talking about. And I'm totally okay with that now.
Yeah,
So probably my biggest intimidation is, judgment. I mean, if I was to summarize it, getting judged in
yeah,
some way. So
yeah.
yeah.
Particularly from our peers, because
Oh
we
my
seem to be
gosh.
very good
Yes.
at
No,
that.
you nailed that. Yes. Oh my gosh. Yes. Yes. That's
We're
exactly it.
very, very good at that.
Yes,
Yeah, yeah.
because that is, and in what I do and the social environment, a lot of times I have been not like DMs. I get people sliding into my DMs and lecturing me and telling me how can you do this and those kinds of things. Um, so yeah, sometimes don't like it. It's all right.
And unless we talk about it, it's not going to change. But
Mm-mm.
that's why we're here, and that's
Mm-hmm.
why people like yourself are brave enough to go, okay, Joe, this sounds like a really big deal. Let's make it happen.
Yeah, this intimidates
Okay.
me. This. I'm doing, you see
Oh,
my cheeks are all red. This intimidates me. Ugh.
well, thank you so very, very much for being here. We're almost done. Um, okay, so we know what you're talking about. You're going to help us understand failure. You're going to help us understand how to be human, but that's an acronym of human. And we're going to be able to walk away with a better sense of self-assuredness. Would that be correct? We don't
Yes.
have to have all the answers. It doesn't
No.
mean we don't need supervision or coaching or consultation. But I think what I'm looking forward to is being able to walk away with a better understanding of when I need to ask for help.
Yes.
And so I think that's going to help cement that for me. So I haven't heard this what you're presenting on. So I get to hear everybody because I'm introducing you all. So that's exciting. So I will put a link for you to register today, not join a wait list. You can register today, and
Oh,
we are and it starts Monday of next Monday, the Monday that's coming up in your calendar for the last 2 weeks in September. We are so looking forward to bringing this to you. Thank you, Cindy, for your time today.
thanks for having me.
I look forward to hearing more of this conversation. Bye.
Bye.